Hey guys, Dr. Nate here again at Thrive Dental and Orthodontics. I'm joined by my lovely wife again, Dr. Christine, and we're gonna get into some interesting stuff today. Today's topic is the truth about dentists. That's right. So we've both been practicing for over a decade now. And so
Can't believe that. Went by so fast, wow.
So we're going to talk to you about a couple of the things that you probably don't know. This is stuff that we talk to our friends about, or when we're out at dinner, that we definitely do not let patients know. So this will be a little different story here.
Some secrets of dentists.
Some secrets. All right, so let's dive right into it.
Okay. Did you know that dentists often get nervous about recommending or diagnosing certain things, or maybe diagnosing too many cavities and things like that, because they don't want to offend the patient or overwhelm them, or the patient may have gone to a previous dentist before and they didn't diagnose anything, or a lot of things were missed, and then they come to us, and if we're saying, hey, you got all these cavities, then the patient may get offended or start to get a little bit suspicious and think, oh, are you trying to oversell me? And so that's something that we as dentists really worry about, because we never want to overwhelm the patient or give them the wrong idea. We only want to offer what the patient exactly needs.
Right. So especially at our offices, we really believe in preventative care. So if people have, there's anomalies or issues on their teeth where there's this darkness on the teeth, some dentists may not treat it. We believe big time in preventative care. We want to get those things when they're really small, so you don't have to get those crowns or those root canals or those extractions. And so sometimes we're like, oh, you have this, 3, 4, 5, 6, 7, 8, 9, 10 imperfections in your mouth that we're trying to treat.
Maybe some stains or baby cavities, things like that.
And so we're trying to treat those, and sometimes, we get nervous about telling the patients all these things because we know there's always the trust issue between the patients and dentists, and so we're really trying to build that rapport. But we get nervous just like you guys get nervous about all the different issues kind of going on in your mouth. So that is one thing that you probably did not know about dentists. I think number 2 you probably did not know is that we get nervous with difficult procedures as well. It's not just you. I know when you're coming into the dental office, you're like, oh my gosh, I have to get this done, and you're nervous, and it's your first time in the office or second time, you kind of don't know what to expect. But you know what? If it's not a routine procedure, there's a lot of procedures that are pretty routine that you probably don't think too much about. But if it's something that's more difficult, like a difficult extraction, or for me, if I'm bonding something that's really tough to get at, or an appliance we don't use very much,
or a root canal that's very complicated with an extra root that's hidden, that's hard to find, or something weird is going on with the tooth, because every mouth, every tooth, every person is so different. Our bodies are so different. So sometimes you get in there, you're like, I don't know what to even expect, because it's always like a surprise.
So that sometimes we get nervous, not all the time, but there's definitely days or procedures that you get nervous about, or you're like, oh man, tomorrow I have that procedure. So we get nervous with certain things, just like you guys.
Because we want to do a good job for you. We don't want to traumatize our patients, because sometimes they can be difficult procedures, and we understand, and it's stressful for us too. Another thing is that dentists often, we get frustrated because we can't control everything, even though we want to control things to make sure that we're providing the best quality of care. Sometimes a patient may not be able to open their mouth, or they're not compliant, or they're very anxious or nervous and not cooperating. There's so many different factors that come into play, because dentistry is tooth surgery inside of a tooth, in a very dark area in a mouth where there's saliva and even blood sometimes, and then tongues that get in the way, and cheeks, and some people just can't open very wide. So it could be very difficult at times, lots of things splashing, and so there's just some things that we can't control, and so that can be a little bit frustrating at times.
And that kind of ties into this other point too, that sometimes dentistry, actually all the time with dentistry, we cannot be 100% sure that everything's going to go just as planned. Our bodies are crazy. Everybody's bodies, even though the teeth may look very similar, they're all slightly different. And not only that, patients will respond to things differently. Your body responds to things differently. We can tell you to do certain things, you don't do certain things. Even if you do the things perfectly, your body sometimes just responds differently. So sometimes it's frustrating because we can't be 100% sure that what we're recommending is always going to work out.
Exactly. So that's why we always do the best we can, and we always hope for the best, and we always want to over deliver. So sometimes we'll just warn patients, hey, this is the worst case scenario. We're hoping this doesn't happen, but this is what we see, and this is what we're going to do to take care of it. And we often want to over deliver so that the patient is relieved, versus surprising them with, oh, sorry, this didn't work out the way we expected, and surprise,
All right, another point is dealing with insurance is a flippin' headache, and it is 24/7 all the time. So I like to tell people this example. Have you ever gone into an accident, or have you ever had an issue with your house, or where you've had anything where you have to deal with insurance? You know how tough it is. You know, calling that State Farm agent or that whatever agent it is, trying to get them to pay for whatever they said they're supposed to pay for. Imagine doing that with every single patient, every single procedure, every single office, all day, every day. I'd say maybe 30% of our staff, that's all they do. They're dealing with insurances, figuring out your insurance, trying to bill for insurance, dealing with claims, on the phone with insurance companies.
Trying to get these insurance companies to pay. And of course, the MO of the insurance companies is to not pay.
Right.
So it's always this battle with us versus the insurance. We want the insurance to cover these benefits for our patients so that we could get these procedures done for them.
Yeah.
But these insurance companies, their goal in life is to not pay. So it's a constant battle.
They're in the business of not paying. That's what insurance companies are. So, but it's obviously necessary that we need to do that, but dealing with it is tough. Okay, last but not least, I think that most dentists are actually very, very happy with the choice that they made. You know, they went through school to have this amazing life, and I think most dentists will agree that their lives are great. Although you may hear differently that the dentist has a higher suicide rate, right? That was a thing
that was an old study, and that I don't think that really applies to today. Yes, dentistry can be very challenging. It's very taxing on your body and your mind, and it's very demanding, but it's a high pressure job. But there's also a lot of gratification in being able to help our patients, get them out of pain, help them live healthy lives so that they could smile with confidence. Because if you can't smile with confidence, everything in your life suffers. There's numerous studies over all the years proving that if you have a beautiful smile, you can be successful in life. You generally have more happiness in life. Like, who doesn't want that, right?
All right, guys, there you go. That is like the 5 or 6 things that us dentists talk about when we're at dinner. Man, we do a lot of dental talk actually at dinner too. Not only at work, but at dinner as well.
We gotta work on that.
But those are the 5 things or 6 things that we talk about often. And as you guys know, we're trying to put out videos every single week,
answering all your biggest dental questions.
So if you were surprised by this video, surprised by some of the answers, please leave those comments below.
Let us know.
And subscribe, and we'll see you guys in the next video.